Hello viewers, so this is my second tutorial. We're going to do emergency preparative care. Today it's surgery. Alright, so my names are Angolushe Chanda, abbreviated as AC. Some of you are wondering what is AC. Okay, I'm Angolushe Chanda. Okay, so emergency preoperative care is the care given to a patient prior to emergency surgery. Okay, so there are so many conditions that require emergency surgery, such as peritonitis, acute abdomen and intestinal obstruction, and many more. So this is the general management. Please stay focused. Okay, so as we all know that the all managements, when beginning, we start with aims, objectives, goals. So the aims of this emergency preparative care is to resuscitate the patient, to prepare the patient for emergency surgery, to preserve life. This is a very good format, standard NMCZ acceptable. Yeah, you never go wrong. Okay. So on the second heading, we are going to write resuscitation. So you write resuscitation, then beneath you write, I will do a quick assessment using the letter A, B, C, D. Alright, and then you start A, dash airway. You underline, then you say, I will check for any foreign body in the mouth and remove to clear the airway. Point 2. I will put the patient in a lateral position to aid in free drainage of secretion to clear the airway. Then, number 3. If there are secretions, I will suction the patient to clear the airway. So, I'm sure you're wondering why I'm putting I. That is the standard. That is how you should be writing. That is how the sentences must be coming out. Don't just write check for any foreign body in the mouth and remove to clear airway. You will get it wrong. You include I. Throughout the management, you write I will. Okay? Alright. So we go on the second letter, which is B. So B stands for breathing. Alright. So I will check for the rising and falling of the chest. If not present, I will do a cardiopulmonary resuscitation to initiate breathing. Okay. Bullet 2. If no chest movements are present after cardiopulmonary, I will intubate the patient to initiate breathing. Alright. Then number 3. If the chest movements are present, I will count the respirations to act as baseline data. Alright. Then the third letter is C, which stands for circulation. Okay. So under circulation, right, I will check for the pulse rate and blood pressure to detect shock. Okay. Then secondly, if blood pressure is low, I will establish an intravenous line and put up fluid such as normal saline to treat shock. So you see how the sentences are coming out. You should know where the I will should be. Okay. So for example, on the second bullet, you don't start with I will, but you write if blood pressure is low, and then you write I will establish an intravenous line and put up fluids such as normal saline to treat shock. Lastly, I will check the oxygen saturations level using a pulse oximeter. If below 90, then I will administer oxygen, okay, via face masks, or nasal plunge. Alright. Then D, which is drug, stroke, disability. So before you take the patient to the theater, you should check the vital signs, and then you also ask the patient if he or she has any chronic condition. It may be asthma, it may be diabetes, it may be hypertension, you know. So it's very important to correct the medical condition. It could be epilepsy, so you check for any disability that can interfere with surgery and correct it, e.g. convulsions. Alright? And then I will check the glucose level. If hypoglycemia is present, give 50% dextrose bolus to treat it. You don't send the patient to the theater with low blood sugars. Okay? You don't send the patient to theater with convulsions or hypertension. They will die. Alright, so it's important you correct these medical conditions and you maintain the blood sugars. Alright. So, investigations. As we said, this is a general management. So, I will correct blood for hemoglobin level to rule out anemia. Okay, there's a chance of this person being anemic. I will collect blood for group pain and cross match in readiness for transfusion if need arises. You know, a person may lose blood during the procedure in the theater. Therefore, it is important you prepare all these things. The blood transfusion, if needed, for immediate intervention before we lose the patient after surgery. Okay. Then I will collect full blood count to rule out any infections. Alright. Then I will take the patient for an urgent X-ray. Okay, an urgent X-ray. Okay, to confirm the diagnosis. Yeah. These are the investigations. If there are special investigations, you also include them. But this is the general preoperative care. For any condition, it applies. So if there are special investigations, you include, I repeat, you include the special investigations if they are there. For example, in BPH, there are special investigations there. So there are conditions that are specific investigations, so they must come out. But for this one, it's a general management. Alright. So the next heading is observations. So since this patient is since it's an emergency preoperative care, you don't write all the I will check the temperature to rule out infection. I will check the blood pressure to rule out shock. No, you just write I will check the vital signs. Okay, e.g. blood pressure, pulse, respirations, and temperature, which will act as baseline data. That's all. This sentence only. No rationales, no words like I will check infections I'll check the temperature to rule out infection. No, just write this. Then you are done. I will check the vital signs, blood pressure, pulse, respiration, temperature, which will act as baseline data. Alright? Then you are done. Okay. But in other conditions which are not an emergency, you explain. Okay? Yeah. So psychological care is very important. So you as an healthy care and as an health care person, you explain to the patient and relative the importance of undergoing emergency surgery, that it will preserve or save his or her life. So I will explain the importance of undergoing emergency surgery to the patient and relative, that it will preserve his or her life. Alright. Then the second point, I will explain all procedures being done on the patient to allay anxiety. The third point, allow the patient to verbalize. I will allow the patient to verbalize his or her concerns and address them according to allay anxiety. Then, I will reassure the patient that as a medical team, we are doing everything possible to make him or her better to allay anxiety. Okay. So, after psychological care, you obtain the consent. So, explain to the patient and relative the importance of signing a consent form and allow the patient, if conscious, to sign if they have understood. Alright? So, if it's a child, you leave it to the parents for them to sign. But if it's an adult, they should sign if they are conscious on their own. So it acts as a legal document. This consent form may fight for you in the court of law. Alright? There are people who just want to bring you down in your career. But if that person signed the consent form and they say you did the procedure without informing them, the consent form itself, if it has been signed by that person, it's going to fight for you because it will indicate that this patient signed for the procedure. Alright, that's the purpose. This is why it's saying it acts as a legal document. Yeah. So you write. I will explain to the patient and relative the importance of signing the consent form and allow the patient, if conscious, to sign if they have understood. And then rationale, it's also a point on its own. It acts as a legal document. Okay. Yeah. Then immediate preparation. Okay. So in immediate preparation, there's skin preparation, bladder preparation, and gastric preparation. So we go skin preparation. You write a subtitle. I will shave the patient depending with where the operation will be done to prevent infection as the hair harbors microorganisms. So if this patient is diagnosed with maybe for example intestinal obstructions, this person obviously we're going to shave the abdomen, okay? As the hair harbors microorganisms. Yeah. Then wipe the patient to promote comfort. So I will wipe the patient to promote comfort. Don't bath. It's an emergency preparative care. Don't bath the patient but wipe. So, secondly, bladder preparation. So I will insert a catheter to empty the bladder as a full bladder can be injured during surgery. Okay? So you insert the catheter. Imagine this person, the bladder is full and you're carrying out an abdominal operation. It's very, 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 very possible to cut the bladder, to injure the bladder. Alright? Or this person may just urinate while you're doing the emergency surgery, and urine, those are waste products going on the sterile field, which is infection. You're introducing infection. So it's very important to catheterize this patient. Alright. Gastric preparation. So I will insert a nasogastric tube to deflate the abdomen, aspirate the abdominal contents. Alright. So mostly before, when you go to in pre-op, it's very important to insert a nasogastric tube, because this person, maybe he or she had eaten and then he went in an attack. Okay, so it's very important to insert a nasogastric tube and then you deflate so that you are safe, alright, to prevent the backflow, alright, of the abdominal contents. Okay. So here, this is the physical preparation, so you can't see properly, but this is the physical preparation. Okay, physical preparation. I'm sure you can see now. So this is the physical preparation. All right. So I will remove the jewelries, prosthesis, ring to prevent the patient from electrocution during surgery. So as you are conducting the surgery in theater, patients are removed all these rings to prevent electrocution. All right. Yeah. So I will remove the denture from the patient as he or she may swallow them when under the influence of anesthesia, leading to blockage of the airway. So you remove false teeth, the dentures. This person will be injected with anesthesia, of which the muscles are going to relax. All right, the muscles will relax, and this patient may easily swallow the dentures. So therefore, you remove them to prevent blockage of the airway. All right, yeah. So keep the patient valuable in a safe place. Make sure their clothes, their case, or their wallets are put in place, all right, to prevent loss. So keep the patient valuable in a safe place, all right. Sometimes in the hospital there might be thieves, she's a maid or is a maid, but safety, all right. So if the patient has nail polish, lipstick, remove it for easy observation of cyanosis. So I remember when I was in college, my friend, like we were given this male patient, all right. He had intestinal obstruction, and my friend, he was a male patient in the scenario, and then my friend wrote, uh, I will remove the nail polish and lipstick, okay, for his observation of cyanosis, and it just underlines the what's this the sentence, like, this is a male patient, not a female, unless maybe it's gay, but oh. The world is changing so fast. Even men are putting on nail polish and lipstick. Alright, okay. So labeling of the patient is very important. I will put an identity band containing the following details: name of the patient, age, sex, type of procedure, site, for identification purpose. So imagine you bring this patient to the theater, then you've not put the identity band. It's confusing. How is the doctor going to know the site of the type of procedure, the site? Okay. So if this patient is having an operation on the eye, make sure you write left eye. Okay. If the patient is having an incision on the abdomen, make sure you indicate, okay, that it's the abdomen. The age and the sex, the doctor must have this information, all of it. Okay, for identification purposes. So medication, I will administer promethazine, atropine to dry up secretions. Okay, administer promethazine, atropine to dry up secretions. Alright, this is straightforward. Then escorting the patient to theater. This is escorting the patient to theater. Alright, okay. I will collect all necessary documents such as laboratory results, X-ray films, patient's file, and escort the patient to theater. So you collect all the documents containing the patient's information. Alright? Yeah. Then you carry on and you go to the theater. I will give a full handover to the receiving nurse in theater, which will include name of the patient, age, sex, type of procedure, site of operation, laboratory results, latest vital signs, and pre-medication given. So the nurse you are giving an handover to must be given this information fully: the name of the patient, age, sex, type of procedure being done, okay, site of operation, laboratory results, alright, latest vital signs, and the pre-medication. Okay. So, and then you write, upon giving a handover, I will go back to the ward and make a postoperative bed containing bed accessories such as suction machine, oxygen cylinder, drip stands, in readiness to receive the patient. So this is how the layout must come out. Alright. Okay, so thank you very much. See you next time. Don't forget to subscribe, like the video, share the video, download it if possible. Alright, I will appreciate. Thank you very much. Have a good day.